walk into the room, you're going to introduce yourself to your patient, do your patient identifiers, and let them know what you're planning on doing. So we're putting a Foley cath in, and we're going to prep our patient. With the mannequins, we're just putting our legs out. With our patient, you would ask them to bend their knees, and we're going to open our kit. It's got a few different things. This one just reminds you to clean the perineal area, and if you haven't already done that, so you can use the soap that comes with the kit. Here's your kit, and it tells you which way you need to orient it, especially if you're right-handed and standing on the right side of the patient. So we're going to put our package here. We're orienting it towards the patient here. But ideally, if you're left-handed, when you're orienting your package, you want to make sure you're opening the first flap away from you, so your last one is towards you, and you're not going over your sterile field. Your gloves are inside the package on top. Be careful that you're not touching anything else when you grab your glove package. And you're going to open your gloves away from your sterile field. You've got 2 drapes in your Foley kit. Open them carefully and grab your top corners. Your shiny side goes down. Be careful you're not touching the legs. And you can lay it down, and then you can adjust it with your sterile gloves. Your second one is your fenestrated drape, which has a hole in the center. Please plan on using that as well. Grab your top corners, and you're going to lay this down as well. Don't touch the gown. And it just extends your sterile field. You can then put your package on top of your drape there. If you open your package and you realize you can't remember what you need to be doing next, it's actually numbered 1, 2, 3. This one says open your iodine. And here it says pour your iodine here. We would open this, we would pour it over the sponges, but we're not going to do that when we're working with the mannequins. Number 3 is attach your water syringe. Take the cap off. You can just set it in there. We're going to attach our syringe to the port that will blow up the balloon. We're going to carefully take off this blue plastic cover. Carefully take it off so your catheter doesn't slip out of your sterile field. And then the last one is dispensing some lube. Take your cap off as well. And we're going to squirt some in the corner. You can need to do just a little bit for practice purposes. When you're in the hospital, you would squirt the whole syringe in the corner there. All right, so we're ready to clean. We're going to separate the labia. We're going to take our sponges that are covered in iodine. We're going to go down the inside of one side of your labia, front to back, come around your sterile field. We're going to go down the other side, inside your labia, front to back, around your sterile field, and then down the center. Notice I hadn't lubed my catheter yet. I'm going to lube it now. When I'm ready to put it in, let your patient know just to take a deep breath. Be careful that that catheter is not going to touch your sleeve. And if you grab it a little bit closer, you have more control of it. Take a deep breath. And we're going to put our catheter in. When you get to the point where you would start seeing some urine coming back, you would put it in 1 to 2 more inches. So we're going to put it in 1 to 2 more inches. We can then grab onto it here because we're not going to insert it any further. Reach down and grab your syringe. You're gonna blow up your balloon, then reach down and grab this connection to disconnect. We're gonna pull out gently until we meet some resistance. We know the balloon is at the entrance of the bladder. At this point in time, we would change our gloves before we put the bag on the side of the bed. You're just going to use some non-sterile gloves to finish the rest. Once we put the catheter in, we don't need to be sterile anymore. Each kit comes with a stat lock, which we already have on the mannequin's leg. Arrow goes towards the patient, and there's a little point sticking up that goes in the Y of the catheter, and the bag will hang on the side of the bed. When you're in the patient's room and you've done this in the hospital, you would just tear your fenestrated drape and you would throw all this away. But when we're in practicing, we do reset our station. So that is Foley cath insertion. Be sure you do your checks as you leave the room. Make sure your bed is in its lowest position, 2 side rails are up, and your call light is within reach.